There's a reason researchers use animals for experiments. And yet some medicines can only be tested on humans, which can tempt scientists to use themselves as guinea pigs. There can be no better warning against the dangers of self-experimentation than the classic horror story, Jekyll and Hyde. The respectable Dr. Jekyll uses himself as a medical test subject and becomes the monstrous Mr. Hyde. But this story is more than fiction. Real-life dentist Horace Wells will ultimately descend a path just as dark as Dr. Jekyll. Horace Wells is a popular and respected medic.
Yes, if you care to come this way.
Family dentist with a young wife and son.
Dentistry in the 19th century was brutal, nasty, and long.
Wells has what all good dentists need.
Try to relax.
A strong arm and nerves of steel.
Now, miss, I'm going to make this as painless as possible.
In the first half of the 19th century, dentistry was brutal, without anesthesia, and it involved very few tools.
Ah, yeah, I think I can see it. Is it this one? All right, I think there's a couple in there, actually. Thank you.
Here we have a pair of dental forceps, and the object was to grasp the tooth firmly and yank it in one go.
Okay, now this might hurt just a little bit, all right? Hold tight, that's it.
The most clever instrument I have here is the tooth key. There's a loop of metal here, and that would be secured next to the tooth. And with a turn of the key, that loop would tighten around the tooth. And when the grip was solid, you'd give it a good forward smooth yank to remove that tooth. You can still get this tool in a hardware store today. It's called a basin wrench, and you don't remove teeth, but pipes.
All right, now the second one.
At the time, even a minor dental problem would require a full tooth extraction. So you either went with this process or lived with possible infection and death.
Some would rather risk death than sit in a dentist's chair. Until Horace Wells stumbles across something that will change dentistry forever. He sees a humorous demonstration of the effects of something new, something called laughing gas. People who inhale it seem oblivious to pain.
Nitrous oxide, also known as laughing gas, started out as a party drug and as a circus trick.
The show gets Wells thinking. Could nitrous oxide make dentistry painless? Maybe even fun? In this world of pain, would you choose to test it? The only willing guinea pig is Wells himself.
Which one?
Left wisdom.
Left wisdom?
Yeah. Hold still.
Wells?
After successfully using laughing gas on his patients, Wells realizes he's sitting on a potential revolution in dentistry. He's ready to go public.
Horace Wells found nitrous oxide to be a very good anesthetic for dentistry, and he wanted to publicize this as best he could. And the best way in those days was to hold a public event and demonstrate it.
If Wells can market this painkiller, not only will he make his fortune, he'll become world famous.
Ladies and gentlemen, for the first time, dentistry no longer has to be painful. Thanks to a revolutionary new technique that I've discovered.
Just relax, my friend.
Yeah, that's it, that's it. How do you feel?
I shall now remove the offending tooth.
relax, all right?
But at this critical moment, unlike the success of all his previous
It
tests,
doesn't normally do this. It
the
doesn't
nitrous oxide simply doesn't work.
It works. It usually works. I've done this before with people. You ask any patient.
The problem with these early anesthetics is that the people using them didn't know how they worked.
We know that the effects of nitrous oxide vary enormously from person to person.
It works.
People didn't know the actual dose to give, and they weren't sure, so they were testing and experimenting with different doses. So it's not surprising that in certain situations, they didn't get a high enough dose.
It works.
Wells' one shot at public recognition is a tragic failure.
It works.
The humiliation breaks him. He loses his clients, he loses his business. He gives up on dentistry altogether. But while Wells is lost in despair, his old assistant Morton remains captivated by the idea of ending the agony of dental work. Morton discovers that fumes from a liquid called ether are far more reliable than laughing gas.
Ladies and gentlemen, thank you for coming.
Ether can induce a deeper level of sedation in the patient.
Please breathe deeply. Open wide.
Morton succeeds where Wells failed. It is his name that hits the press as the inventor of anesthesia. Spurred on by Morton's fame, Wells returns to dentistry, armed with a new wonder drug he believes will be the best painkiller yet. He thinks the only risk is further humiliation. That is the least of the dangers that face him. Horace Wells, a man publicly humiliated in his attempts to make medical procedures painless. He will use himself as the guinea pig to test a new pain-killing drug, chloroform. Nitrous oxide leaves you conscious but lessens the pain. Ether sedates you. But chloroform, first it renders you delirious, then unconscious. The difference between an effective anesthetic dose and a dangerous one is very, very small.
Sometimes the patient wouldn't go under the anesthetic for a long time, would inhale this anesthetic continuously. The problem is it would be dissolved in certain tissues of the body and accumulate.
After 4 weeks of experimentation, dangerously high levels of chloroform must be accumulating in Wells' body. Wells has no idea of the danger he faces.
Chloroform is quite addictive and also quite toxic in the brain. And because of this toxicity, chronic use creates a very delusional and hallucinatory state.
As protection against his terrifying hallucinations, Wells arms himself with scalpels and sulfuric acid. Outside, he begins to lose all sense of reality.
Are you all right?
Under the influence of the drug that was going to save his reputation, Wells disfigures a woman with acid. Horace Wells writes his wife and son from jail, begging forgiveness. He's a criminal, a drug abuser. But a week earlier, a group of his peers acknowledged him as the true inventor of anesthesia. He kills himself before the accolades can reach him. He does not live to see anesthesia revolutionize medicine, making all manner of surgeries possible and all of our lives more livable.